Sleeping disorders, also known as sleep disorders or sleep disturbances, can have a variety of causes. They can stem from physical, psychological, or environmental factors. Here are some common reasons for sleeping disorders. 1. Stress and anxiety. Worries, stress, and anxiety can keep the mind active and prevent relaxation, making it difficult to fall asleep or stay asleep. 2. Depression. Depression can disrupt sleep patterns, leading to insomnia or excessive sleepiness. 3. Medical conditions. Various medical conditions such as chronic pain, like arthritis or fibromyalgia, asthma, gastroesophageal reflux disease, GERD, and sleep apnea can interfere with sleep quality. 4. Chronic pain. Conditions causing persistent pain, such as arthritis or back pain, can make it difficult to find a comfortable sleeping position. 5. Sleep apnea. Sleep apnea is a disorder in which breathing repeatedly stops and starts during sleep, leading to fragmented sleep and daytime fatigue. 6. Restless leg syndrome, RLS. RLS is characterized by an urge to move the legs, often accompanied by uncomfortable sensations, and it can disrupt sleep. 7. Circadian rhythm disruptions. Irregular sleep schedules, shift work, jet lag, and conditions like delayed sleep phase disorder can lead to circadian rhythm disruptions. 8. Substance use. Consumption of caffeine, nicotine, and alcohol close to bedtime can interfere with sleep. 9. Medications. Certain medications, such as those for hypertension, asthma, or depression, can impact sleep. 10. Hormonal changes. Hormonal changes due to pregnancy, menopause, or conditions like thyroid disorders can affect sleep. 11. Environmental factors. Noise, light, temperature, and an uncomfortable mattress or pillow can contribute to sleep disturbances. 12. Excessive screen time. Exposure to screens, phones, computers, TVs, emitting blue light before bedtime can interfere with the production of melatonin, a hormone that regulates sleep. 13. Poor sleep hygiene. Not following healthy sleep habits, such as maintaining a consistent sleep schedule, having a comfortable sleep environment, and avoiding stimulating activities before bedtime, can lead to sleep disruptions. 14. Narcolepsy. Narcolepsy is a neurological disorder that affects the brain's ability to regulate sleep-wake cycles, leading to excessive daytime sleepiness and sudden sleep attacks. 15. Parasomnias. Parasomnias are abnormal behaviors or movements during sleep, such as sleepwalking, night terrors, and REM sleep behavior disorder. 16. Psychological factors. Trauma, post-traumatic stress disorder, PTSD, and other psychological conditions can impact sleep. 17. Age. Sleep patterns naturally change with age, and older adults may experience changes in sleep duration and quality. 18. Genetics. Some sleep disorders, like narcolepsy, can have a genetic component. It's important to note that identifying the underlying cause of a sleep disorder is essential for effective treatment. If you're experiencing persistent sleep problems, it's recommended to consult a healthcare professional, such as a sleep specialist or a doctor, to determine the cause and receive appropriate guidance and treatment. Thanks for watching.